think we'll give it maybe about another 30 seconds or so, and then we can just get started.
Yeah, I guess everyone is cool, calm, and collected today.
Yeah, that's okay, because then we can get it recorded.
Mhm.
YouTube. All right, I guess we can go ahead and start.
Okay. Sorry.
No, you're fine, you're fine.
Yeah. Our little disclaimer. So these webinar sessions are hosted by Rachel Lindberg, a Master of Counseling Psychology practicum student, and Ashley McLeod, a Master of Social Work field work student. We're both supervised by Mark Ram, LPC, and Director of Angela State Counseling Services. These webinar sessions are informational and psychoeducational and are not intended to be used as psychotherapeutic treatment. So if this session causes any psychological or emotional discomfort, please feel free to call Angela State Counseling Services at 325-942-2371 or the crisis helpline at 325-486-6345 for immediate assistance 24/7. So a little bit about us. I am Ashley McLeod. I am a social work advanced standing graduate field student. I conduct intake assessments and provide case management services to students. After graduation, I'm going to seek licensure as a licensed master social worker. And then a little fun fact about me is I listen to about like 10 different podcasts. So that's how I decompress and stress.
Awesome. I'm Rachel. I'm the counseling psychology graduate practicum student. I conduct intake assessments and I can also provide individual, couples, and group counseling. After I graduate this December, I'll be seeking licensure as a licensed professional counselor intern. And then for my fun fact, I put that I share a birthday with one of my dogs. So that's always my favorite part of the year. So, we're going to be talking today about how to process anger. This is an emotion that's not fun, although it's one of probably the ones that like it looks okay to like it. It's more acceptable to be angry than it is to be sad or ashamed or some of those other emotions. So that's kind of why we chose to talk about it today. So, what is anger? Everybody knows that's like one of the big main emotions, but maybe not exactly what it always means. So, anger is the feeling and intensity. It can vary from person to person, and it may be dependent on the situation. So, you can be angry, which is feeling or showing anger or strong resentment. Mad, which might be like a little bit less severe, be enraged, greatly provoked, irritated. And these words are sometimes used like interchangeably, and they're all related to each other. You can be really irate, infuriated, furious, or acting out through aggression. Aggression is usually a behavior rather than the emotion itself. And that's like an outcome of feeling these emotions. So aggression is more the action of a state and violating by force the rights of another, and it can be an unprovoked offensive attack or invasion. So these are just kind of words that might be used throughout the presentation. They kind of depends on the person. Sometimes you might say like you're just so furious, but not as mad. It just kind of depends on like the severity, or not severity, but like the intensity of the situation and what you're feeling. So, anger itself is an emotion characterized by antagonism towards someone or something you feel has deliberately done you wrong. So, what anger is usually telling us is that something is not going our way, whether it's somebody else doing an action toward us. It could be our own behaviors and actions, us messing up something, making a mistake about something. It's really just somebody's doing something toward you or something's not going your way. And anger isn't necessarily a bad thing. Anger can be a fantastic motivator to fix an injustice, to fix something that might be going wrong. However, excessive anger can create problems. It can result in violent outbursts and lead to other issues with physical and mental health, including high blood pressure and some others that we'll talk about later. So it can create other problems in your life. It doesn't exist in a bubble. It usually has like kind of a waterfall effect and affects other parts of our lives. So, like any emotion, anger is really normal and healthy. Like it's okay to be angry and it's okay to be upset. And what it's trying to do is tell you a message that the situation you're in is threatening, unjust, or upsetting. So it's really just trying to tell you something. And from there, you can make the decision on what you want to do and how you want to handle it. So some of the effects of anger include effects to your physical health, mental health, occupational or academic functioning, and also interpersonal relationships. So with physical health, high levels of stress and anger can actually increase your risk of heart disease, diabetes, a weakened immune system, it can cause insomnia, and high blood pressure. So those are some pretty serious health problems that could be related to a lot of different outcomes, like needing treatment, other medications, and things like that. For mental health, ruminating over what is making you angry can increase stress, depression, impairs concentration. If you're just dwelling and ruminating over something that happened days ago, weeks ago, months ago, years ago, holding a grudge, that's not healthy and that can make you feel more stressed. And if that's all you're thinking about, then it's going to impair your concentration, but can also go into affecting your occupational and academic functioning. So when you're acting out because you're angry, whether it's aggressive or not, other behaviors can occur aside from, punching somebody out. Those behaviors can result in job loss, difficulty with peers and authority figures, whether it's a professor or a boss or a parent, parent or guardian. And it also diminishes mutual respect. It's really difficult to relate to somebody and talk to people when you're angry. They want to talk to somebody who's being respectful, and whoever you're dealing with might look at you differently or might not take you as seriously because you can't control your emotions. Which, really goes into interpersonal relationships. When we act or behave angry, it impairs trust, communication, healthy boundaries, and it can result in the loss of friends or significant others. Speaking with somebody who is really angry, especially if they are displaying aggressive behaviors, that can be really scary. So, there's starts to be a lack of trust and unsurety of like what kind of person you might get that day. They might be fearful of how you might react even if they're just trying to have a simple conversation about like what's for dinner that day. So it really goes on to affect your other relationships as well. So how can we identify anger? Most of the time you just say, I'm so mad, but really, like, does our what are our physical and emotional responses to when we're angry? So some ways we might feel emotionally when we're angry, besides anger, is like emotional dumping. We might want to just let it all out by venting or wanting to gossip and get it all out. And we might say a lot of things or do something that we don't necessarily mean because we're trying to get it out in a way that's not necessarily healthy. You might display some unclear thinking. Our judgment gets clouded when we're angry. Like I just said, you might say or do something you don't mean because we're just like seeing red. That's all we can see in the moment. So yeah, venting, insulting another person or even yourself. If you're angry at yourself, sometimes we say things that we would never say to another person, and that can really, really, really harm like your self-esteem and confidence in yourself. So, screaming, raising your voice, punching or throwing objects, which could really be dangerous for other people or even yourself because you could hurt yourself or hurt others. And then also being argumentative or aggressive. So, these are all ways that we respond emotionally when we're feeling angry. Now, physically, our emotions and our bodies physically are very connected. So, when we're angry, you might feel the tensing of muscles, in your neck or shoulders or back. You might clench your jaw and make your jaw really tight, which, sometimes that hurts when you're gritting your teeth. Even having a panic attack, you might respond in that way. Not everybody experiences anger. Sometimes when people are mad and they're fighting with somebody, they cry. And that looks very different than somebody who might have the urge to hit somebody. And just because that's different doesn't mean that they're not both experiencing anger in that moment. It can also cause gastrointestinal issues like acid reflux and give you an upset stomach. That's another thing that's hard to deal with because when you're fighting with somebody, you're angry with somebody, and all of a sudden you're nauseous, doesn't make the situation any better. Raises your blood pressure and gives you a surge of adrenaline, which initiates your fight or flight response. So when we want to fight back, whether that's with words or an action like punching or hitting, or it can also initiate the flight response. And that sometimes when people are angry, they just walk out of the room and they don't even finish the conversation. So that's another response that could happen. So why are we angry? Sometimes it's really easy to pinpoint why, like somebody stealing your parking spot or, a bad driver. So what needs to happen to figure out the why behind being angry is identifying your possible triggers or situations that cause an anger response, and it'll be easier to manage that anger. So if you get really bad road rage and you get bad road rage, then you'll be able to, before you get into the car, develop some strategies to keep yourself calm and relaxed when you get in the car and while you're driving. That way you can hopefully manage that rather than be angry while you're driving, because an angry driver is a dangerous driver. Also, being a bad driver is a dangerous driving as well. So, you really got to give some balance to that sometimes. But it's also important to identify how your body responds to these events, and that will help you identify the triggers. So, like I said earlier, if you know that you cry when you get mad, and you also have road rage, then crying while driving just adds more, more dangerousness to the situation. So, sometimes you might not even realize you're angry, but you also know your stomach's upset. So you kind of have to ask yourself, why is my stomach upset right now? Why are my shoulders so tense? And what situation am I in? And that will kind of help you identify what's going on. So practicing mindfulness, that can help you identify the building of angry feelings. Sometimes we kind of start with like a mild irritation, then all of a sudden it builds into being enraged and furious. So if you can kind of, identify when that irritation started and what's causing that irritation, you can kind of see the steps that it takes to exploding the steps that it takes to being, an explosion. And if you're mindful of that irritation, then you can hopefully get it to a point where you can kind of stop it where it's at before it gets too serious. Um, so yeah, and then also identifying your primary emotions. We're not always just angry. We're going to talk about this in a second. Sometimes we might feel shame, hurt, fear, sadness, and those emotions need to be dealt with along with the anger. So here we go. Anger as a secondary emotion. So often anger accompanies other emotions that are more difficult to experience and process. These are the emotions that make us feel really vulnerable and often bring us to the point where we would rather be angry because it's so much easier to tell someone you're mad than it is to tell them that you're ashamed. So some examples are like feeling afraid, attacked, offended, disrespected, forced, trapped, embarrassed, insecure, shameful, or sad. So, a lot of the reason why we display anger before identifying any of these other emotions is because we grew up in a family where those more vulnerable emotions were discouraged. You know, especially like with little boys, they say like little boys like don't cry, don't cry. But if a little boy goes up and pulls on a girl's pigtail, it's like, oh, boys will be boys. Even though that's kind of like, I don't want to say an act of aggression because most 5 years olds aren't described as aggressive, but really like when you go and touch another person without them asking, that's a violation of a right, and which is an aggressive act. So I know it sounds like a severe way to explain it, but it's so much easier to be like, well, I'm angry, rather than I'm ashamed or embarrassed. Those are the more uncomfortable ones. So once you figure out what the primary emotion is, you'll be more aware of what you're actually feeling, and you can process and express that emotion more effectively. So when does anger become an issue? So, like we said earlier, anger is it's not necessarily a bad emotion to experience. It's perfectly healthy, perfectly valid. However, when it negatively affects your well-being, when it's too intense that it clouds your judgment and it affects your behavior, when it negatively affects others, so if it causes you to act out and, like I said a second ago, violate another person's rights or, hurt another person, and also when it negatively affects your performance at work or school. So this would be an opportunity for to be able to ask for help and maybe modify your behaviors and learn how to manage that anger so that it doesn't end up into a severe consequence. Because if we hit somebody, that's physical assault, and it could result in so much more than what we think it might, like jail or getting arrested. So that's not as funny. Sorry. But anyway, so how can anger be utilized? So using feelings of anger to process repressed emotions, and these repressed emotions might be the ones that are more vulnerable, like embarrassment or shame. You can use anger to reveal personal weak spots. Like, why am I angry? And it might be an area that you kind of feel like you can improve in, and then find that area and use it to strengthen yourself. You can use anger to move out of complacency. So what this means, and this is actually very relevant right now with the Black Lives Matter protests, and I'm not really trying not to get political, but a lot of people are expressing how uncomfortable a lot of government and political systems have been. And when you don't speak up or don't act out, that can be a sign of complacency. So when you get angry about these things because there is injustice, then you can use that anger, kind of channel it in a healthy way to advocate. So and it doesn't only pertain to what's going on in politics in the world right now. It can be for other issues as well. So and this relates very well. So you can use that anger as a motivation to accomplish your goals. If you're mad that you got an F on a test and you're mad at your professor, you can take a look and be like, well, maybe my weak spot is this subject. So I can strengthen my skills in this subject and then accomplish your goal of trying to get a higher grade. So that's how it all gets kind of connected. And then you can also use anger to identify negative people in your life. These emotions may be contagious. You know, do you have an angry aunt or uncle who doesn't treat you well? Or do you have a not so good relationship with your siblings? You know, you can practice awareness to identify these negative relationships and then take steps to make them more constructive and more healthy. You know, just because they're family, you know, there's a negative relationship there, and they, or even if they're not family, it could be a friend too as well. They're just a toxic person in your life and they make you angry, change it. You know, you have the power and the control to change it sometimes. So there's that. And then you can also transform anger into passion. You know, if we are angry about something that is related to a sort of injustice, you can turn it into a passion for advocating for the rights of others, which can then go into fueling societal change. So those are some healthy ways that anger can be utilized.
Now it's my turn. Okay, so some tips on managing anger. So probably one of the most important things is thinking before you speak. So not saying things just right as soon as they come in your mind, because it might be offensive or inflame a situation rather than being productive. And then once you're calm, expressing your anger in a healthy, effective way. So after you've had that time to kind of cool off, you're not so hot, as we like to say. And then getting some exercise is a great way. I would be mindful of this though, because if that exercise includes like acts of aggression, associating those acts of aggression with anger can create or kind of foster violent outbursts in the future. So getting some exercise, doing some cardio, doing something that's maybe fun and kind of getting that energy out is a good way to kind of manage that anger. And or taking a time out. If you're arguing with your significant other and both of you are really mad and it's a very intense moment, saying, hey, I need a minute, I need 15 minutes, I'll come back. I'm gonna go for a walk around the block and I'll come back. Taking a timeout can be a very useful tool and very effective. A couple things associated with taking a timeout, making sure that you're not stonewalling the partner or other person in the fight. So making sure you're not just kind of completely shutting down their feelings or experience. And then also it's beneficial to set time limits, and a good tip is if you leave, you're the one that comes back. So that's a good tip. Tips around timeouts. Using I statements. So I statements can be are very powerful. This is people always kind of make fun of I statements a little bit, but it's like I feel angry when you do this, something like that. So just identifying how it makes you feel, and you can even use I statements with yourself to kind of identify the emotions that you're actually feeling. So naming and putting kind of that label on what you're actually feeling can be a very powerful tool. And then also you can identify possible solutions. If you always have a fight at Thanksgiving dinner with your family, maybe there's some not allowed topics, or things like that. Not holding grudges, this can be so hard, but making sure that if you're resolving something with someone, that it's actually resolved, so you don't hold on to those feelings. Using humor to reduce tension. This is a great tool kind of in the moment, or even if you've been so angry and so stressed out, maybe putting on a funny movie or listening to a comedian. And then also just like telling jokes in a situation where you might normally not can be a great way to reduce tension. Practicing relaxation skills. So like we talked about with, you might feel these sensations in your body. You might tense up your shoulders or your jaw and you don't necessarily know why you're angry or that you're angry. So practicing relaxation skills is a good way to kind of reduce that tension. And then also identifying, oh, I'm feeling a lot of stress in my shoulders today. I'm having a lot of that tension. And then asking for help. Asking for help is a great skill. It is such a strength. Being able to identify whenever you need help and being able to reach out and ask for it. And we'll discuss some specific options in a little bit. Okay, so some more tips. Exploring what's behind your anger. So what is that kind of primary emotion that we talked about? Are you feeling shameful or agitated? Are you hungry? Like things like that. So also, we learn most of our coping skills, argument styles, things like that, from observing your family as a child. So did you have parents that were fighting a lot? Did you fight with your sibling a lot? Did you fight in which way? Things like that. So just like seeing what is behind your anger, what's kind of causing it. And then even if it's a symptom of an underlying mental health condition like depression or traumatic experience. Traumatic experiences oftentimes include acts of violence. So it's kind of natural that then whenever you're dealing with that trauma, you would enact in a violent way or an angry way. So being aware of anger warning signs, so physical and emotional, so knowing kind of those triggers, those hot button topics, or situations that can kind of make you angry, get you agitated, and then identifying those triggers. So triggers are things that set you off. So those can be situations, topics, or people that often lead you to feeling angry. So this is like arguing with a partner about money, discussing politics or religion with family, poor drivers, can be a plethora of anything. A long lunch line in the UC can definitely be frustrating. And learning ways to kind of cool down. So engaging in those coping skills and activities, those relaxation techniques to kind of cool yourself off. Anger and aggression to transitioning into assertiveness. So controlling that angry response can keep the person or thing that you're angry at from keeping you even more unhappy in the long run. So if you let things boil over, you're kind of giving that person the power to do that. So controlling your responses can help you to actually work through what's going on and find a good way of coping with things. Assertiveness is a way of communicating feelings in an open and honest manner without violating the rights of others. So we talked about how aggression, these acts of touching other people, yelling at other people are kind of violating their rights. So assertiveness is a great way to kind of take back that control into a productive, equal manner. So assertiveness is utilizing anger in a positive way to affect change without being a bully. So this is very important. So using assertiveness to ask for what you and listen to what the other party wants. without kind of being like too pushy or mean. So some steps for assertiveness is identifying your need. So what do you specifically need from this situation? If you're fighting with your partner about money, do you need it to be more clear about what the budget is? Do you need to sit down at the beginning of every month and make a monthly budget? What is it that you need from that situation, from that person? So having confidence in what you're saying. So you've identified your need, you know what you're bringing to the conversation. So having that confidence, and then being very clear about what you want. So not leaving things up for interpretation, and just making sure that the partner, whoever you're having this interaction with, knows exactly what your need is and what they need to do to meet that need. And then having control in how you're speaking. So this kind of goes into not being a bully, making sure you're not yelling and screaming at your partner, making sure you have control, that you're kind of collected, and things like that. So that's kind of anger to aggression to assertiveness. Anger and interpersonal skills. So it's very important to fight fair. It's okay to express your needs, but you also have to respect the other person's needs too, and the other party's needs. Prioritizing the relationship over winning the argument. So it doesn't really matter who wins the argument if at the end you're both happier and getting your needs met. So that's something that sometimes people tend to hold on to a lot. I want to win the argument. I'm going to say whatever I need to say to where I have the last word. And that's not really prioritizing your relationship. Focusing on being on the present and avoid revisiting old grudges or past events. So this is kind of what we talked about with holding grudges. So not bringing up these past events, not bringing up things that have already been resolved, being willing to forgive. So that's pretty important. Thinking before speaking, let someone know when to let something go. So picking your battles, we hear this all the time. What's the other saying? Oh, don't turn a molehill into a mountain and then like, is this the mountain you're gonna die on? So, those kind of things. Focusing on timing. So having difficult discussions late at night or right before work in the morning can create that anger response. So if it's late at night and you're tired, you're already stressed, you have a full day at work, you have 3 classes today, you're already primed to have that anger response and be mad. The same thing with early in the morning, you might not be ready to have these conversations. So focusing on timing and just making sure that you're focusing on yourself and your partner or the other party. Thinking before speaking or acting. So how important is this in the grand scheme of things? Is this really worth getting angry about? Is it worth ruining the rest of your day? So that kind of goes with timing. Is my response appropriate to the situation? So kind of checking yourself. Am I ready to scream and yell because a stranger accidentally bumped into me in the hallway? Making sure that your responses are appropriate. Is there anything that I can do about it? Or anything that they can do about it? Is this something that is going to create productive conversation? And then is taking action worth my time? So is this something that is going to even be worth your time? How important is it to you? Those are questions that you have to ask yourself whenever speaking or acting out with these feelings of anger. And then, so I have a bunch of resources for you guys. So we will copy these links into the chat box. Let's see. So this one is a list of different coping skills. So being aware of triggers, practicing deep breathing, inhaling for 4 seconds, holding for 4 seconds, and exhaling for 6 seconds. Keeping an anger log. Journaling is a very powerful medium. So going through this list, using diversions, like going for a run or rearranging a room, taking a time out, and kind of the rules for timeouts, and then knowing warning signs are all really important. And then healthy versus unhealthy coping strategies. This is an awesome little list of different coping strategies. So on the unhealthy side of drug or alcohol use, procrastination, social withdrawal, and then the healthy side of talking about your problem, healthy eating, seeking professional help when needed. And then it kind of goes through, it has a little checklist, a little worksheet about what you're dealing with, what your unhealthy coping strategies may be, and then what healthy coping strategies you should be using and those outcomes. Okay, and then when is anger a problem? This one is an awesome little worksheet too. So it kind of goes through a little, has your anger impacted other people? How has the anger negatively affected your performance at work or school? Has anger negatively affected your physical or emotional health? When was a time when your anger was too intense? So this is an awesome little worksheet to kind of go through. This is a worksheet as well about identifying different triggers. Identifying the problem, and then some different trigger categories of like emotional state, people who you were around, places that you were at, things that were going on, thoughts, activities or situations, and then some tips for dealing with triggers. So either avoiding it or practicing your coping strategies. So, and it also goes through identifying these specific triggers, and then ways to avoid or reduce exposure, and then how to deal with it head on when they cannot be avoided. And then this last little worksheet is just some anger management skills. So it's an awesome little handout. So it goes through recognizing your anger early, taking a time out, deep breathing, exercises, expressing your anger, thinking about your consequences, and visualization. So that's an awesome little thing. And if you would like any of those powerful or those worksheets, you can certainly take them out of the chat box. And where to seek help. We've talked a little bit about when to seek help of whenever you're feeling you can't control what's going on, and your feelings are very intense and you just feel like you need assistance. So the ASU Counseling Center, we are still seeing people. We are doing therapy options. And then you can also search for local therapy options at psychologytoday.com. And you can also search and filter through that by counselors who have specific experience and expertise in anger management. And then also finding different podcasts, YouTube videos, articles, and other media that may help, and seeking advising from family, friends, faculty, or professional or personal mentors in your life. Those are all great options of how to seek help. And then some great resources. This is a little resource list. The National Suicide Prevention Line, of course, is 1-800-273-8255. We also have listed the Trevor Lifeline. Happy Pride Month, 866-488-7386. The National Sexual Assault Hotline at 1-800-656-4673. And the Veterans Crisis Line at 800-273-8255, press 1. And then counseling in your area at Psychology Today, and all of these other little great resources. And then our ASU Crisis Helpline number is 325-486-6345. Yes, and if you, I think it's just us right now, but if you have any questions, please feel free to reach out.